Morning, I'll call the meeting to order. Would you please stand for allegiance?
Pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Yeah, do a little house cleaning. Tom's gonna be gone. He might get here late. We do have a personnel meeting after this, so he's gonna try to make it for that. Change on the agenda, the commissioners have pulled the discussion on the antenna, so that is off our agenda. So we have a fairly light agenda today, it looks like. Ryan, you're up first, Highway Department.
Good morning.
Morning.
This here again, as we discussed at the end, it was the November 7th, 2023 meeting. Tractor mowers are nearing completion, hopefully by the end of next week. We done everything, exact collide equipment. And we're next in line to get tractors done, so they're thinking 2 to 3 days per tractor. Hopefully by this time next week, we'll have one of them ready. We'll ship them both at the same time anyways. So here again, we already discussed in November, the $120,689.52 that we paid to more farms for the tractors and the mowers. From the MBH account, 1176400000000176 to equipment, which is 1169410010000217. Read it over so you can make that payment for us.
I wondered, I saw John Deere sitting out at the Largo Fire Department. I'm thinking.
Yeah, we're using that tractor, but we're using it with a flagging truck for safety. So we don't have to worry about cars coming up from behind or ahead of them. Because it's still, you've all seen the pictures, how it doesn't work very well for us, but we're taking extra safety precautions until we get our codes in. We can that tractor back to Morris for traded.
Good.
So when it's all said and done, how many tractors will you have?
2.
Just 2.
And you got the other Kubota out. I saw that Troy Presbyterian Church last night. Yeah.
Wet, it was a wet spring and grass is growing like crazy. So we better use the older equipment to get it started.
Are people calling?
Yes.
Okay, your pleasure.
Make a motion to approve the additional appropriation resolution for $126.89.52.
Motion by John, is there a second? Thor seconds. Any further discussion? Hearing none, all those in favor, raise your right hand. All those opposed, say thanks. Thanks, Ryan.
Yep, thank you.
I see where you had calcium put on their dirt gravel roads.
Yes, all the roads have been done for the year.
Okay. Kim?
Morning, everyone.
Morning.
Morning.
So I'm here just for the additional appropriation with Jamie leaving. This is just for her PTO payout. All this is-
Make a motion to approve the request.
I have a motion by Thor,
Second.
second by Kim, that we approve this request. Any further discussions, questions? Hearing none. All those in favor, raise your right hand. All those opposed, say.
Thank you.
Thank you. Tiffany,
These are the personnel changes that you have already approved. Here's the additional for them. And we will be bringing a salary ordinance a little bit later in the year with any changes that have had, so there's not multiple salary ordinances coming forward.
There's a possibility that it could be absorbed in what's already there.
For our staff, no, because they've been filled the whole time.
Pleasure.
Make a motion to approve.
Motion by Thor,
Second.
second by John. Any further discussion? Hearing none, all those in favor, raise your right hand. All those opposed, the same. Okay, Tiffany, you wanna, are Dale here? Yeah, ones?
And we've got Kim as well.
Yes.
Personal properties, if you have any questions. Dale and I went over the reel and didn't see anything that jumped out to us. Everybody seems to
No, and
be in
once again, when
compliance.
we're looking at them, we're just checking that the investment was made and how close the employment is. And you know, usually there's been a couple of companies around here who are still suffering some of the effects of, COVID, which is a couple of them were under employment. They were mostly with city council, and we didn't see anything that looked out of line. And, I think the health of the business community in the county is still really strong. But like I said, we reviewed them all.
We had a couple, there's two, I think, wasn't there two from last year that were not in compliance?
There was, yeah, and gator cases.
Gator cases and,
Can't remember.
I don't think we had any other county. South Whitley's tech code was non-compliant in CNA, but not within the county.
Has Gator then withdrawn and fallen out of the abatement
They're done.
thing? So they're just, so that's the reason that there's not a red flag there this year, because they're just not in it anymore.
Right.
Were they at the end of their cycle, or they just pulled out?
End of their cycle, yeah. I mean, the last 2 years, they didn't file when they could have. They didn't file through with their CF1s to you, and they could have. So the abatements were denied, but now they're at the end of the 10 years and they're done.
And there was Indiana Materials Processing. They were late, but they had sold a piece of equipment.
Right, yeah. This year, we have advanced materials on the personal property side. I don't even, they filed their abatement forms, but they have not filed their actual return with us. We don't even have a return to put the abatement forms to this year for advanced materials.
But that doesn't keep them out of compliance, because essentially they've done what they are required of, right?
No, they're not compliant because they need to file the return as well. They have to file the whole package to be compliant with our office.
Okay.
But it is the auditor's my recommendation that what you have in front of you is can be approved.
I'll make a motion that we give Jim the authority to review and sign all the CF1s and to get that done for the auditor.
I'll second it.
Second. Motion by Thor, second by Kim, to give Chairman authority to sign the CF1s on behalf and have everybody compliant. Any discussion? All those in favor, raise your right hand. All those opposed, the same.
Did advanced materials file a CF1 with council?
I'll have to go up and look.
Yeah, I
think-
don't remember.
We did get the annual report from the city, their redevelopment commission. That's an annual report they have to give to us, and it just came today, so I'll give that to the auditor so she can. Okay, that's our time. Okay. Very good. Did you want, Scott? I heard you wanted to talk, or Kim said you wanted to talk.
Tracy might be bringing this up. The county commissioners did sign on for the state Health First Indiana funds. That changes things for budget. So the first year you opt in, the state law is that the county has to provide the appropriation of the last 3 years average. And Tiffany's provided that. Basically, it's 500,000. That's what you guys done in the last 3 years, including this year. So the 500,000 has to be appropriated. That's not the budget, that's the appropriation. And then the state gets money as well. I did put a letter in your packet. It'll be for the 25th. It is confusing. I'm going to try to send out a link and provide you some more information on how we have to do this issue. The county commissioners, like I said, signed the paperwork. Their intent is to use the full appropriation from the county, the state funds, and then give money to partners to fulfill the core services that are being required with the funds. So you'll see a breakdown of that intent. That can be changed. Obviously, the council has to approve the budget. In the budget that's been proposed is an increase like we do every year, the 3% raise increase. And the only catch is you'd have to approve the state budget by your August session because it's due September 1st. So that can be changed according to the state. It's just they want that submittal done at that time. So the state is giving us a little over $666,000. Combine that with the 500,000, you're about 1.16 million. Because we took the state money, we lose the 53,000 that we got historically that offset those 3 salaries that typically you saw in our budget. So you look at our budget, which was submitted was 763,000, so that makes it 816. So the $316,000 from what we grabbed from the state, so the county won't be paying that additional. Like last year, our budget was like 706,000. County paid it all. This year, the county's only paying the 500,000. So all the extra money is coming out of the state money. But any money spent at the state, salaries, budget items, all that has to be tied back to a core service. And then also has to be done in a split, 60% or higher for preventable services and 40% or less on regulatory services. And when I send you that link, you'll see the difference on those things. So preventable will be like testing for STDs, car seats, trauma reduction. Regulatory would be like septic systems, food permits, pool inspections. So those have to be broken down on a percentage as well as tied back to a core service. So I'll send those things out so you can see that, and then there probably need to be some discussion with the commissioners on their intent versus what you'd like to see as well. So, any questions? It is kind of confusing.
Go ahead.
Does this in any way, shape, or form constrict us on any decision-making for the health department, whether it's services, salaries, benefits? Are we going to be given direction on where we have to do or parameters, or how? Is there any change there on how that's operating?
No. So unlike probation where the state sets a number, that's not in this. That's completely up to the county. So if say you don't want to propose 3% increase, you don't want to do that, that's taken back, change, whatever. You could say, we don't want to spend the 500,000 appropriation, we're going to take everything out of the state funds and only use a portion of appropriation. You can do that as well. That's between you and commissioners on how you want to do that. I'm just going by their meeting on submitting the budget and agreement. But yes, the state doesn't set any of that. They're just saying you have to complete these core services. Other counties have hired people, other counties have not hired people. Let's do that. I believe the commissioner's intent is not to hire any other personnel to fulfill these requirements, but to pay partners to do some of these things.
Thank you.
My question is, the past positions that were covered under the grants, from what you just said, are dissolving and falling under this?
Right, so when you take the HFI funds, you no longer get the historical monies of 53,000. So you trade in the 53,000 for the 666,000. But also you get extra work to do.
And how long, I guess we can talk about that at budget, that's fine.
So this would only be for budget year 2025. Because the state right now, that stops at the end of 2025 unless this next coming year, they revamp that and add money back into it. It was appropriation, it was not a state law. So it goes away at the end of 2025 if the state does it to me.
So we need to be aware of that so we don't lock in something that we have to pay for the following.
I think that's kind of why the commissioners are saying, we're not hiring anybody. We're gonna take the money to do these things for these partners.
But it does affect the people we hired for the health department under those grants. How many were that, 2?
So Sonia, who's the clerk for immunizations, 20,000 from her salary. Darcy, 20,000 from her salary. And Danielle was paid completely out of one grant, which was around 13,139.
And that dissolves after a year under this program, then we have to figure out how we're gonna pay them after this year.
Well, I don't know. It may go, if the state says, hey, we're not going to do this anymore, it may go back to historical payments. That money may come back. I don't know. Or it may be a reduced amount. I don't know what the state's going to do on that. Yes, it's a new territory. We don't know. But yes, it'd be about $53,000. If it were to go away, yes, we'd have to come back. But that would be reflected in those budgets. Any other questions?
Can you give us a COVID update?
COVID is almost nil right now. Obviously, we do get cases here and there, mostly elderly people. Vaccination rates are way, way down. 1 or 2 a week most. It's just endemic in the population now. It's just like the flu or chicken pox. It comes and goes. Not really seeing a whole lot of deaths with that occasionally. I think our last death was a couple months ago, but it was an elderly person and obviously comorbidities with that. Not seeing that. The big thing you should be thinking about is bird flu. It's all over the news all the time. It's in our mailbox all the time. Warning about bird flu.
Are there any reports or continued testing on the COVID vaccine? And are there any bad results or any results coming out from the continued?
There's lots of information coming out. AstraZeneca withdrew their vaccine a month ago or so because blood clotting. That was from a European study, so that's no longer in existence. There's all kinds of testing coming out. There's changes in what the FDA is saying about the COVID vaccine. They've withdrawn pediatric doses now. You can get it if you wanted to. So that's not even available because they don't get sick from it. So.
Scott, have you heard anything about, I said in a meeting the other day on beef cattle. Have you heard that they're giving the COVID shot to the beef cattle?
Coronavirus vaccinations have gone on in cattle for years. For years. I know Tommy Western said he would do it for 20 years. The COVID-19 virus was the 5th coronavirus that North America has seen in the last 100 years. So we've had other coronaviruses appear in North America. It just didn't affect the human population the way it did. Most of it was animal. And so they've been vaccinated for many years on it. The bird flu, the avian flu, has been found in 2 separate cattle populations, and a worker or owner has been infected with the bird flu, but their only symptom was conjunctivitis, which is. Did I answer all your questions?
Not all of them.
Okay.
So what viewpoint or actions are we taking now to make sure that we are a little bit more gentle on enforcing vaccinations that haven't been tested long enough next time something like this happens? Is there a plan in place to make sure that people who generally were very mild on symptoms for COVID-19, that, you know, we pushed and forced those vaccinations so hard? Is there something to learn there? And are we learning?
That's an answer for the federal level. They're the ones that pushed it out to the state, and then the state just had to do whatever they told them to do. And that's kind of a symptom of the issue that we have in the country to begin with, is that you have a handful of people at a very high level making decision for hundreds of millions of people that necessarily isn't the best decision. I think there's a lot of hesitancy on vaccinations, period. Indiana has suffered greatly. I don't know about other states, but our childhood vaccinations that you typically would bring your child in to get the last 30 years has decreased significantly. I've reported before that Whitley County is number 2 in the state on vaccinations for children under 2, which is great, but we're only at 75%, which is terrible. So a lot of people are not getting vaccinations. It seems as though the new generation, the 20s and early 30s, they're not getting their kids vaccinated, especially even against the things that we've done for 50 years, mumps, rubella, whooping cough, the normal things that have been safe. They're not doing that anymore. My greater fear is that illnesses that have been eradicated in the last century will be coming back. We'll be dealing with them all over again. Not only with people who are choosing not to get it, but also people coming in the country that's not vaccinated.
So then they're not eradicated.
They're in other third world countries. They're just for eradicating the United States.
Don't they have to have proof of those to get into school? Or did they not do that?
They can sign a religious exemption. And they are doing quite a bit. Any other questions? I will try to somehow link that. It's easy to understand about HFI. Please reach out to me. Questions on that. Again, there's probably discussions with the commissioners on how you want to proceed with that budget. But I will do my best to make it work.
Thank you, Scott.
Thank you. Okay. Commissioners report?
It's actually been a pretty quiet month, other than the state funds for health. It's really the only thing we're working on. I think climate's good though.
Teresa, would you care to share with council where we're at with the solid waste board and what's going on with our contract or potential new contract there?
So between GFL and us, it sounds like, well, they didn't want to do a contract extension after all. And then neither did we, because it was going to be just so high. So we got a committee around to get an RFP out. They did come up with what they would like in there, and we approved that at the last meeting. So hopefully we'll get some good bids on solid.
Thank you.
What's the time frame on that, Teresa?
I want to say it was like 2 or 3 months. I don't know off the top of my head. It wasn't long, because obviously I think January 26th was like the end of this contract. So obviously to get an entire new company up and going, they would need to figure out those logistics sooner rather than later.
We had a 9-month window that we had to advise GFL that we were putting it out. Otherwise it would have renewed at their price.
Yeah.
Anything else, Teresa?
No.
Any comments from the public? Okay. We have 2 sets of minutes. One is our regular meeting, that was May 8th. Got a motion?
Approve as written.
Okay, motion by John, and we approve as written. There's a second?
Second.
Second by Thor. Further discussion? All those in favor, raise your right hand. All those opposed, say. Then we have our executive session minutes. Same day, May 8th.
Motion to approve those.
Motion by Nick that we approve those. Is there a second?
Second.
Second by John. Further discussion? All those in favor, raise your right hand. All those opposed, the same. We do have a personnel committee meeting next after this one. Tiffany, you have anything? Remember, budget is the 25th of June. What do you want to do for lunch? There was some talk of just staying here and stuff or something. We can get that arranged if we want to do that, or
That works for me. Power through it, get it done. We're over with.
Sounds good to me.
does that sound all right?
Makes no difference to me.
Sounds good to me.
And that's what we'll do, and you'll probably get a little questionnaire just saying what kind of sub or something you want, we'll get it taken care of. Okay. John, you have anything?
I have nothing.
Joe?
No.
Dor?
I have nothing.
Nick?
Nothing.
The only thing I have is Old Settlers is coming up. Kim and I are working, we're on the committee on that. It actually is a good time for the community. When you get into this position, you learn what it takes to put that on, cost. It'll open your eyes sometimes, in the entertainment, the bands and so forth. Buy your tickets ahead of time for your kids or grandkids, because you save $7 a seat. And hopefully the weather will be good and it'll be good for the community. Other than that, I have nothing. Meeting's adjourned.
What's the date of Midsummer's this week?
18th.